So please correct me if I'm wrong, but based on the 17.3 million, which is the governor's initial release for the Ohana Zone's funding, the Big Island gets significantly less than other islands. So because it's based on an RFP, is that more to do with the county failing to request that Ohana Zone funding? Because I was under the impression that the Big Island has the worst homelessness problem per capita.
One of the challenges with the Big Island was the fact that because of the natural disasters, both the flood and the volcano, when we worked with their housing department, it was a matter of, okay, where do we build it? At that time that we were trying to make decisions in terms of how best to move forward, the lava was still flowing. And again, we had to make sure that we didn't mix up the homeless structures that we're going to build versus transitional homes that we're going to do for the people who lost. There were some 700 homes that were destroyed. And so, doing temporary housing basically for Hawaii Island was very important as well. So there's a fine line between the two in terms of what will be considered permanent homeless shelter or transitional homes versus transitional homes basically for those that have been displaced by the volcano. So I think that could be one of the reasons. But again, what I can do is I can try to see what exactly Hawaii Island proposed and I can get back to you.
Okay. And then as a quick follow-up, so there was originally $30 million appropriated. So is the intent of the governor's office to additionally release that additional 12.7?
Absolutely, yes.
Okay. And is there a timetable for that, or is it just kind of dependent on the counties?
Again, as quickly as we like to work, we work with the counties, and unless they come back to us in a timely manner, we don't want to. We don't want to just put things out for the sake of putting things out. So we want to make sure that all the counties have a say in terms of what's going to be done, because they know better than anybody else basically where the homeless areas are and where these transitional or these homes should be placed. So we're just going to wait to see what we hear back from them. But I can get you a timeline.
That's fine. Thank you.
I've actually asked the governor to trust me with the lion's share of homeless initiatives, especially the innovative approach that has emerged in the last 2 years. I think they've done a pretty good job working on some of the nuts and bolts of homelessness, the more traditional stuff, as they look at housing first or just traditional housing, but this was a new beast. So I'm with the Gov today at 11. I've already, as Brooke pointed out, expressed interest in dealing with what we looked at, which is the chronic homeless pieces, the people that are more intractable, that's so hard to help, the people that have had encampments but not enough support. I would like him to give me ownership of that responsibility. I'm trying to be mindful not to tread on the toes of some of the people that are already there. And this is just the initial part of the transition, because he's still even choosing his directors. Some people are staying over. As we know, there will be some changes. We'll know in the coming days and weeks, certainly before his State of the State address, how much he feels comfortable giving me. I would like to have chronic homelessness in my portfolio. I would also say you should call me on this or any issue. But for the Ohana zones, we sent a memo over to the Gov asking at least right off the bat to consider the rest of that resource to be something I either control or give major input in with your recommendations. And I just think homelessness we have had two different perspectives between the legislative branch and the executive branch on pieces of homelessness, and I do get it. So I'd like to have chronic homelessness, which blends into opioid addiction and mental health care, which we know all come together. And then the Gov's also mentioned the healthcare provider shortage is an area of expertise I might help with.
Okay, because I think, as Representative Todd pointed out, that the funding that was allocated for Big Island is substantially lower than other areas, but especially during the lava eruption, Ohana Zone money was crucial to take care of some of those needs during that time. So it didn't have to be a permanent structure. That's why we put in cash, as you know. We didn't want CIP because we didn't want it to be a permanent structure. And so especially for Kauai and Big Island, it would have been good if we could have used Ohana Zone money to take care of the homeless situation right away. for lava situation. And as you know, $30 million was less than what we had initially wanted, because I think you were advocating for a larger
Yeah.
amount.
Yes.
So the question is this. So now in this administration, you're at least you're more knowledgeable about homeless and mental health issues than the current governor's office or people in the governor's office. But the question is, what happens if you're not able to do what you have the potential of doing?
I may have to rejoin you in the Senate or the House, or more likely I'll just fight like a dog to make sure that they utilize me. In healthcare and homelessness, that's the issue that more than just taking care of our needs for people who are really severely debilitated, to your larger approach about using money properly in our government, I see it as an opportunity to bring back $50 to $60 million of resource that is used less than efficiently in our system. We spend a lot of money on Medicaid that could be spent much better for people who are homeless, who have comorbidities, more than one condition, and who need our help. That's why you're right about the $1 million that we appropriated also for emergency room diversion, the $30 million, which was meant to be $15 million for Oahu and $5 million for each of the other 3 counties, to divert people from getting sick and then getting flown over here at high expense. So whenever I can get the gov's ear, I harp on that. I come with graphs and presentations, which I'm happy to give when dust settles for everyone in the ledge. I do believe that that's the area he'll use me, whether or not, and this will be, of course, up to the administration, because they were talking about flow charts, and I was interested to hear, just like you, whether or not the flow charts have some things falling under the lieutenant governor's office. For instance, that's what they did in Utah. Though we are not Utah, Utah did have some similarities to us on the homeless crisis, and they placed their homeless directors underneath lieutenant governor's office, so there was one focus, and then I could be right with you guys. So it'll be up to everyone around me to decide what's best, but my recommendation is to put homelessness from the perspective of people who are suffering badly under LG.
Okay, so I guess this will be a test case. So if it actually doesn't work out and somehow, your talents and experiences are not fully utilized, I think the question on people's mind will be, is the lieutenant governor's role effectively being utilized by the state, and whether we should move towards eliminating the lieutenant governor's office and make it a appointed Secretary of State position. And I think that's a question a lot of people in the public also have, because ultimately, if you will be handcuffed, if the lieutenant governor will be handcuffed in just doing just doing what the governor tells you to do, in spite of the fact that you might know more than what their office does, I think, it leads to whether we should have an elected lieutenant governor at all. So we'll grandfather you.
Yes.
But then after you, we should have a serious discussion about what this role is and what kind of function best serves the public, whether it's an elected position or whether it's a appointed Secretary of State position.